Dr. Sanjiti,
Oh,
for
sir.
this very kind and lucid introduction. I am always obliged to IMA for giving me the opportunity to talk on various topics. And I also thank today's initiative, the company which has taken initiative for inviting me to deliver talk on this lecture, on this topic. Sorry. Hypertension is not a new disease, and everybody knows that hypertension has been there since ages, and everybody has been treating hypertension on a day-to-day basis. There is nothing new to hypertension, but what is new to in this particular era is the number of cases which we are getting in the past few years has risen tremendously. Earlier, it was thought to be a disease of the elderly, where patients above 60 years, when they used to come to to the clinics and to hospitals for symptoms, when their BP was checked, it was found that their BP used to be high. But now the onset of the disease has become very, very early. Who are also nowadays who are on the borderline, or who are like having a blood pressure of 140/90, 150/80, and who fall in the pre-hypertensive. I would like to draw your attention to this kind of scenario, and we will discuss in this talk about how this scenario has definitely hello.
Yeah, there was some network issue, sir. We couldn't hear you. Please go on.
Yeah,
Thank you.
hello. Am I audible now?
Yeah, we can
Yes,
hear
sir.
you. Please go on.
So
Yes.
coming back to the point that hypertension has become much more common than it was around 10 years back, and it is the onset of the disease has come down drastically in ladies as well as in gents because of variety of factors. So, as you know, hypertension is elevation of blood pressure beyond a certain limit. Blood pressure is the pressure generated by the heart for pumping, making the blood available to the rest of the body. It is traditionally calculated as cardiac output into the peripheral resistance, and it is known that the systolic pressure in general denotes the cardiac output, whereas the diastolic pressure denotes the peripheral resistance. So if the person has got low cardiac output, his systolic blood pressure will be on the lower side, and if the person has got sepsis or is got some other problem, the peripheral resistance will be low, which will lead to systolic hypotension. But if the peripheral resistance is high, it will lead to diastolic hypertension. Earlier, these figures were thought to be, or they are always in every year decided by the Joint National Commission and the European Commission, and they give us figures which are verified by Indian Society for Hypertension, and then we get a figure of, so 120/80 was normal blood pressure. Now, and treatment was started by when the blood pressure is 40/90 or 150/90, but every year they give us new guidelines, and based on which we have to modify the clinical decisions. Hypertension can be primary or secondary. Earlier, it was said that hypertension is because of stiffness of arteries, which lead to increase in peripheral resistance, and therefore there is the essential hypertension, which is a disease of the elderly. Because of atherosclerosis of the blood vessels, there is increase in the stiffness, and because of increase in stiffness, there is increase in peripheral resistance, and because of increase in peripheral resistance, there is hypertension. Now we have seen that because of increase in adrenal activity, because of increase in stress, though the arteries are not stiff, still there is increase in peripheral resistance, because of which the diastolic blood pressure is starting to rise. Next slide, please. Next slide, please. Piyush, hello.
Yes, sir. Which this sir?
Can we go to the next slide, please? Yes, yes. So, what are the probable reasons of sudden rise in number of cases with hypertension? First and the foremost, obesity. Average body weight of the population has risen definitely, and this is because of lack of exercise and lack of physical activity. If you see, if you compare to the generation which was there before, they were physically much more active than what we are now, and our children are much less active than what we were. So, because of lack of physical exercise, there is increase in the weight, and because of increasing in the weight, there is increase in the blood pressure. Second, of course, is obesity because of again sedentary lifestyle. There is increase in the body weight, and because of which there is increased demand of the body, and that demand of the body increases the systolic increase causes systolic hypertension. Excessive salt intake. Indian population and Japanese population are known to have 10 times of what is the daily requirement of sodium in our diet. So earlier in Indian scenario, there used to be a lot of sweating because of the excessive physical activity, as well as hot weather, as well as there used to be a lot of sodium loss during the episodes of diarrhea. So in our traditional eating habits, we used to always start with 5 grams of salt in our uh, diet or our plate. So and there used to be increased uh, sodium or increased salt in our dietary habits in the form of pickles. Because of famines and because of droughts, the fresh vegetables were not available. So people used to store vegetables in the form of pickles, and that used to be the source of nutrition for ages. But now, with the increase, with the good irrigation policies, the vegetables are available, but our tastes have remained the same. So because of which, in the Indian cuisine, if you see the average salt intake is almost 25 to 30 grams per day, when the actual salt intake required is 2 to 3 grams per day. So 10 times of more salt is consumed by every individual every day, and this excessive salt causes a pressure on the renal system to excrete this sodium through the urine, and therefore our serum sodium levels keep on rising, and which directly has got a effect on peripheral resistance as well as the systolic blood pressure also. So diastolic and systolic increase by at least 10 millimeters of mercury while because of our increased salt. Then another big aspect of our social upbringing is tobacco. Every form of tobacco causes rise in heart rate and rise in blood pressure. Tobacco was used earlier by the labor to increase the blood flow to their brain so that they feel fresh and used to go back to the work. But we are using tobacco in our day-to-day dietary habits on a very large scale, and because of which there is an increase alpha stimulation causing increase in blood pressure. Other factors and stress are very factors, and these factors lead to tremendous increase in adrenergic level, and they give rise to accelerated hypertension or hypertension in general. Next slide. So in this problem, then these are examples of secondary hypertension, because whatever we were discussing till now uh, is the primary hypertension, where hypertension is the root cause of all diseases. In secondary hypertension, there are many diseases which themselves cause increase in the blood pressure. Renal causes are there. Then there is something increased adrenergic level because of diseases like pheochromocytoma. Then elevated intracranial pressure can lead to hypertension, and there are various other causes. So while evaluating a person with primary, when a person presents to us with symptoms like headache, then increased irritability, or in general with some other features such as seizure, sudden unconsciousness or sudden seizures. When we get a patient, then we check the blood pressure. He or she has to be evaluated on an immediate basis for a variety of factors. Hello? Hello?
Yes, sir. Go on.
Go on.
So in this scenario where a person is found unconscious or has been brought to the casualty with different kind of emergencies, equipment like MiFi can definitely help us decide whether this problem is because of secondary hypertension or the problem is because of primary hypertension. Next slide, please. Early diagnosis. Sorry, there are, I think, 2 slides are missing. Piyush?
So, second, you wanted this one?
Before that, Indian scenario and global scenario.
So, this is what we have.
Next slide.
The previous slide. So what is the scale of this hypertension? While Piyush is working on that, I'll let you. So scale of hypertension is not a problem only limited to India. It is a worldwide problem. Worldwide, it is estimated that around 20 to 25% of the population. Yeah. So yeah, global scenario. Thank you. Globally, it is estimated that 26% of the world population, that is 972 million, that is almost 97 crore people, have hypertension, and the prevalence is expected to rise to 29% by 2025. Such is the scale of this problem that hypertension has become a very big or bigger problem than diabetes, or maybe equivalent to diabetes, in which a normal individual who may or may not have symptoms on screening is showing signs of hypertension. So when the person becomes symptomatic, that is okay. But before the symptoms, also the patients are rising, and it is estimated to become 29%. Whereas presently there is 26% of the world population. That is a very, very huge figure. It is mainly in the economically stable countries, but underprivileged countries are also not a exception to this problem. On the Indian side, we can see, can you go to the next slide? There has been a very big lacuna and dearth in estimation in the Indian population because of geographical reasons. But reviews report that overall estimated prevalence for hypertension in India was 30% already. So what is estimated by 2025 on the global scenario, we already have it now. And the significant differences in hypertension prevalence was noted between the rural and the urban population. So urban population, because of stress, I feel, has got much more higher incidence of hypertension in general. People don't check their blood pressure, which is a very, very simple test, which doesn't require any invasive method, but still the awareness about hypertension is very low, and poor lifestyle, dietary modification, increase excessive use of salt, excessive tobacco use, lack of exercise, and stress. Most importantly, the stress, multiple types of stress. Trying to reach the office early, then trying to cope up with the financial needs, trying to cope up with the expectations of the clients, trying to cope up with the traffic scenario, then agitation, excessive anger, all these factors definitely, and lack of sleep. Lack of sleep is also a very important factor because most of the Indian population they sleep for only 6 to 7 hours a day, and when the recommended sleep is at least 8 hours of sleep in the young adulthood, which goes on, of course, goes on reducing naturally. But in the young adulthood also, people keep on enjoying till late nights and don't wake up early for, and they wake up early for their daily course also. So, because of all these multiple factors, India is heading towards becoming the hypertension capital of the world. In this scenario, what can we help and how can we make a difference in the situation? We can start very simple things like visiting the doctor. Whenever people visit the doctor, they can start checking their blood pressure, or you can use equipment like this. This can be definitely of boon where sort of generalized checkup is done with a in a very short span of time. So if a person comes to a doctor complaining of occipital headache or mild blurring of vision or lethargy, you can subject him to very simple tests like blood pressure measurement. And if it is abnormal, then we can go ahead with plethora of tests. If the person need not go from one point to the other, and their compliance will be very high. Diagnosing them early can have a major impact on the soft tissues of the body. We can prevent a lot of disease such as heart disease, such as brain infarcts and brain hemorrhages. Then we can prevent a lot of renal disease also, which are now becoming secondary to hypertension. So more amount of renal disease than vice versa. Can we go to the last slide, please? Can you go to the last slide, please? No, no, one earlier. Yeah. Then laboratory investigations, as has been discussed in the earlier talks, that simple clinic-based equipment which these people have developed with a lot of scientific and progress and a lot of trouble. These kind of equipment definitely will make a difference in the patient compliance, and they will be eager to get their data because this is the uh, era of getting instant. Everything is people want is instant, and it has to be accurate also. So any equipment which is instant, which is accurate, which is visible, which is easy to use, and which is not cause a lot of pain, is going to be acceptable. Then radiological investigations such as 2D echo, ultrasound of the abdomen, sometimes CT brain definitely will help in the management of hypertension. Urine investigation, most important, to look out for secondary renal diseases and to look out for other rare diseases are PG, then 2D followed by stress test are definitely important in the management of hypertension. Lifestyle modifications we have discussed at detail. And lastly, but most important is antihypertensive drugs. So people have a notion that once a person is put on antihypertensive, the person will be always on antihypertensives for life. That is not true. Many of the patients they go off treatment because their blood pressure goes back to normal. What doesn't go back to normal is the change in lifestyle. So they keep on having the bad lifestyle with them. They keep on eating a lot of salt, drinking excessive alcohol. They don't change their tobacco habits, and because of that, their antihypertensives keep on rising as per their blood pressure requirement, and physician keeps on telling them, "If don't do this, don't do this," but they simply turn a deaf ear to that directives, increase their antihypertensive, and therefore they feel that once a person is put on antihypertensive, this person will be always on that. So antihypertensive drugs is a matter of seminar. There are huge choices of antihypertensive drugs, and this is beyond the scope of today's talk. So we will end today's talk by saying early diagnosis, early treatment, and early reporting, early diagnosis, and early treatment will definitely make a difference in the outcome of hypertension, which is going to be the next challenge which we'll have to face. Even in COVID, we have seen patients who have got comorbid conditions like hypertension and diabetes and obesity. They had a worse prognosis than the person with no comorbidities or with having a healthier lifestyle and good physiological result. So with this, I would like to hand over to Dr. Sanjeti. If there are questions, I am ready to answer with them. And thank you very much for listening.
Thank you.